Hello everyone. This video highlights the African diaspora's wealth of expertise and how this expertise is being utilized in their host countries and also impacting healthcare delivery in Africa. Let's listen. Hello, welcome back to the Chronicles of a Ghanaian Diaspora Nurse, the Return. Thank you so much for tuning in again. Today, I have a guest who is joining us all the way from Halifax, Nova Scotia in Canada. Dr. Vincent Ejapon is a professor of psychiatry and global mental health and the head of Department of Psychiatry at Dalhousie University. He's also the Chief of Psychiatry for the Central Zone of Nova Scotia Health Authority. He was the inaugural director of the Division of Community Psychiatry at the Department of Psychiatry, University of Alberta, and also served as the Alberta Health Services Edmonton Zone Clinical Section Chief for Community Mental Health for 5 years prior to taking up his current appointment. He has over 120 publications in international peer-reviewed journals and has made over 65 presentations at national and international conferences in 18 countries across 5 continents. His research focuses primarily on health innovations that expand access to quality mental health care, and he has had over 80,000 subscribers to his various supportive text message interventions, including his Text4Hope program, launched in Alberta during the COVID-19 pandemic, which had over 30,000 subscribers in just 1 week. He has received over $6 million in research grants from national and international funding agencies. He has also won numerous awards related to his work, including Health Innovation Award in 2011 from the Royal Power magazine, Alberta Services Spirit of Excellence Award in 2016, the Edmonton Zone Medical Staff Association Physician Innovator of the Year Award in 2018, Champion of Mental Health from the Edmonton Mental Health Foundation in 2018, the Momentum Mental Health Clinician Stroke Researcher Award in 2019, and the Alberta Medical Association's Award for Compassionate Service in 2019. The award goes on and on and on. In addition, Dr. Ejapon has had the Text4Mood program, his brainchild, recognized by the Mental Health Innovations Network, which is headquartered at the Department of Mental Health and Substance Abuse of the World Health Organization in Geneva, Switzerland. Whoa, that's a whole lot of experiences there, Dr. Ejapon. Thank you so much.
Thank you very much, Rita,
for joining us, and sharing your experience with us. So let's just begin by telling us, how long you've been a doctor for and where were you trained?
Yeah, so I trained in Kumasi at the Kwame Nkrumah University of Science and Technology, Ghana, graduated in 2001. And I left for Dublin, where I completed my psychiatry training and completed a number of postgraduate courses as well, including 2 PhD programs before moving over to Canada in 2013.
Thank you. Thank you so much. I mean, reading through your biography and, the amount of work and all the things that you've achieved, what would you say has been your greatest achievement in your whole medical career?
Well, I'm in completing my graduate, my psychiatry residency training program in 2008. I went to Ghana, and the hope was to return home and add to the 4 psychiatrists in Ghana that were there at the time, to make as 5 psychiatrists. But then my family had some reservations about relocating home. So I designed a program to try and increase the number of psychiatrists in Ghana, even though I wasn't in Ghana. So I secure some sponsorship from St. Patrick's University Hospital and St. John of God Development Hospital in Dublin, and launched an annual intermedical students public speaking competition in Ghana for the medical schools to compete. And the winners and the runners up were sponsored over to Dublin. We've had so far about 29 Ghanaian medical students have come to Dublin on one month of elective sponsorship, fully paid for. Now we've had, the number of psychiatrists in Ghana have increased from 4 in 2008 when I went to Ghana. We have now over 50 psychiatrists. It's not just because of the debate, but it certainly contributed to increasing the interest of Ghanaian medical students in psychiatry. And this is what I'm most proud of.
Wow, thank you. Thank you for that. I remember the first time I was part of a team, going back to Ghana to, offer training and skills share in mental health. And there were only, I think there were only 3 then. This was 2006, 2007. And now more than 50. And
more than 50, and there are a lot in training as well.
Yeah, it's really, really encouraging. And I'm aware that the young up and coming doctors are choosing the field of psychiatry, and no doubt all of your contributions, have resulted in this, plus other health professionals who are also giving their quota to the training back home in Ghana. So I would like to talk about your, the Text4Hope program or project later on, but I just wanted to know, is there anything currently that you are doing in Ghana in terms of training, or is it the same thing you started with the doctors coming over? Is it still running, or are you involved in something new currently?
Yeah, so I mean, I even before we initiated the intermedical student public speaking competition, I was going to Ghana annually from 2008 when I first went there until 2013 when I left Canada. So I was going annually to go and teach psychiatry at the Kwame Nkrumah University of Science and Technology, where I completed, and it was all at my cost. There was no, nobody paying my flight or paying me anything, for that. It was just a contribution to give back, and again to try and stimulate the interest of the Ghanaian medical students in psychiatry. Mm-hmm. So, I mean, in 2016, when I completed my PhD in global mental health, I had a dream of establishing a similar training program at the master's level for Ghanaians and also for people in the sub-Saharan African region, to be able to upskill them and train them in the act of actually developing mental health services, evaluating mental health services. And so with the support of Michelle Funk, who was the coordinator for the World Health Organization Substance Use Disorder Department, and other international partners, we successfully established a master's program in global mental health services policy and development at Kwame Nkrumah University of Science and Technology. So I took about 7 different faculty from Canada, the US, Ireland, and Nigeria to go to Ghana for the inaugural program. I think the first cohort graduated last week, but it's unfortunate I had to pull out before the first batch even could, graduate from the program because of, very typical problems that sometimes Ghanaians abroad who are trying to help back home face. And yeah, we can talk about that later.
Yeah, we certainly will. And I think before we go to the challenges that you encountered, I wanted to talk about the Text4Hope program that was your idea, or you led the innovation in that. Can you tell us a bit about what it is, Text4Hope?
Yeah, so for my first doctoral study, it was actually an MD, Doctor of Medicine in Clinical Psychiatry Research. I undertook a randomized controlled trial looking at the impact of supportive text messaging on patients with major depressive disorder and comorbid substance use disorder who had been discharged from St. Patrick's University Hospital in Dublin. And the results suggested that, for those patients who received the twice daily supported text messages, they did better in terms of their symptom reduction and also abstinence from alcohol after they are discharged from hospital compared to those who did not receive the intervention. So when I moved to Canada in 2013, I wanted to kind of translate that knowledge into something that will be beneficial for patients. So I sought and received some funding from Alberta Health Services. One study working in Dublin does not necessarily mean it's going to be effective in a Canadian population. So with that funding, we replicated the randomized controlled trial in two populations, one for patients with depression and the other for patients with alcohol use disorder. And we achieved similar results to what we had in Dublin. So on foot of the success of that, we launched the Text4Mood program. And the Text4Mood program is a program people can just subscribe by texting the word mood to a short code number, and then they receive 6 months of daily supportive text messages, which have been crafted by cognitive behavioral therapists, service users, psychiatrists to address anxiety, depression, and stress. So when people sign up for the program, they receive a survey which they complete, which measures their base levels of stress, depression. We follow up with a survey at 6 weeks, and again at 3 months, and then at 6 months when they exit from the program. So through those evaluations, we've been able to validate on a population level that these are actually interventions that work. So sometime in, I think, 2017, the World Health Organization affiliated organization, Mental Health Innovation Network, actually recognized the Text4Mood program as a mental health innovation. So besides that, so when the pandemic hit, we thought it would be a very good idea for us to have an intervention that doesn't rely on people, because everybody was stressed. Healthcare workers were stressed, people were in isolation, social distance. And so how do you even bring people to provide them with the counseling if they are struggling? Yeah. So I approached the health authority and said, look, this has worked. The Text4Mood program has been great in the northern part of Alberta. It's addressing two main problems. Problem of wait list to receive counseling, because this has no wait list. Everybody can just enroll and receive the support they need immediately. And also geographical barriers to access. It doesn't matter which part of the country you live in, or whether you're on vacation in the office or you are in the washroom, you will still receive your therapy. You receive the message of the day which you ponder over. So the health authority and some other health foundations agreed it to be a good, kind of program to launch, and they offered us, I think, about $1.2 million then to launch the program in Alberta, which we did. And really within the first week, we had over 30,000 people subscribing. Currently, we've had over 65,000 people subscribing, to the program and receiving various supports. We've since had some more funding from Royal Bank of Canada, who are interested in an Arabic version of the program. So we launched that program just 2 weeks ago. We are going to launch the Mandarin, the French, and the Punjabi versions of the program in collaboration with Alberta Health Services sometime, I think, in the middle of December, in just about 2 weeks or so. So it's a very good program, which I believe would be very helpful, in particular for low and middle income countries as well, because it's very cheap. It costs just, less than the parking ticket that people pay when typically they go to see their psychologist, for them to receive daily supported text messages for 3 months. And if you compare the effects in terms of the results that we are seeing, it's very similar to what you'd see with face-to-face counseling as well.
Yeah, yeah. You know what, when I read about that, I got so excited. I said yes, because I currently work as a local community psychiatric nurse, and so I can totally relate to what you are saying. And with the clients that you see in the community, people who are alone, people who don't have people to talk to, or having issues overwhelming them, and I kind of understand how a text message will bring hope or will bring somebody some comfort. It's really interesting. You mentioned about different languages, and I'm thinking, are we going to have one in Tree?
Yeah, I mean, the reality is actually that, and that's what I told the health authority people, because they wanted more languages. And I said, look, if people cannot be able to actually, speak English, speak French, the dominant languages, and they speak only their local languages, it's also likely that they are illiterate in those languages as well. They cannot read and write.
True.
So we can have a tree program, but the reality is that those who do not read and write English and speak only tree, they cannot read a tree as well. So, I mean, and this is something that you have to read.
Yeah. Yeah, it's a dilemma. But have you ever thought or plan of replicating something like this in Ghana? Because I've often thought about, when I eventually go back to kind of what, I've been thinking about this telephone service, text, things that you can do remotely, but you can be of help to people. So, yeah, do you think it's something that you would?
Yeah, so I have thought about it. Just last week, delivered a lecture to finalist of Ghana Medical School at the invitation of the department head, Professor Angela Furiata. Yeah. And I did indicate to her that, we do have plans of actually coming to Ghana. I'll be having a conversation with her hopefully this weekend about it. And we are developing some other application which even has a better utility in terms of our ability to be able to use it to provide mental health education for example, students in senior high school, university students, and also provide similar content, but it's going to be delivered not just in text message form, but also in an email form. Yeah, so we are also integrating our application with WhatsApp to the extent that we can be able to deliver the intervention to people who use WhatsApp. You can have a phone, there's no subscription plan to it, but because you have internet, you will have WhatsApp, and therefore you should be able to still benefit from the intervention.
Yeah, I think it's a very great idea, and I can't wait to see how this will pan out or work out. So let's come back to the challenges that you faced since you started going back, and given your input, what are some of the challenges that you faced?
Challenges are usually with Ghanaians who have tried to go home and even volunteer and do things at their own cost. It's not very unique, to my person. I have senior colleagues who went ahead of me for a number of years and then just stopped going to Ghana because sometimes, unfortunately, our counterparts back home, perceive people coming as a threat. They sometimes have the notion that you may be coming to come and take their job or their position, even when you have no interest in actually returning, back home. So they try to frustrate you and things, for example, I mean, when going to give lectures in 2008, I did apply, to be formally recognized as an adjunct, lecturer then with the department. And, there wasn't much support from, the person who was the department head there at the time, who wasn't a psychiatrist, and I think there was some perception that if I came home because I'm a psychiatrist, he probably may lose his position. So there was not much support there. So I went for 2 years, to go and teach with no formal, recognition of the work that I was contributing, to the university. And then I went to the dean's office and said, look, I've been asking for this, but I'm not getting any support from, the department head. And he said, just fill this application. Within a week, I received a letter from the registrar's office. I've been appointed an adjunct, a visiting lecturer at the university. So these are some of the problems. So again, when I decided I was going to establish a master's program in international, mental health policy services and development, I brought in faculty from across the globe, Canada, Australia, Ireland, the UK, Nigeria, very solid faculty to really come and do a program that will be of international, repute. But then I started getting pushback to the extent that I ran the program for a year. It took so much of my time. I had to go to Ghana multiple times, and they gave me no formal recognition for the role that I was playing. They didn't want to give me a letter that you are coordinating, this program. You are more or less a person non grata. All they were interested in was the program and the fees that the students were going to pay. And I kept getting questions like, tell us how much money you've collected from international organizations, to support this program. So they had it in their mind that, for you to come and you want to do this program, that you might have collected some huge sums of money. So I drew their attention. I said, look, I have an agreement with these international partners that their institutions are going to pay for the cost of travel of their faculty to Ghana. So it's not direct funding, it's an indirect funding, and it's more sustainable funding. Because if we bring you the money, you are going to spend it and you're not going to bring the right faculty to teach. But if I have this agreement, it means that year on year, for decades, we can continue to have the right faculty teaching on the program. But they didn't want to hear any of that. They said if the money is not hitting their account, then it doesn't count as funding contribution, to the program. And they refused to give me an official appointment. And, and so I had to make a decision to just pull out of the program. I informed the international partners I was pulling out. They all pulled out as well, and we just left it for them. There were so many efforts made by various people, including Canada's ambassador, Ghana's ambassador to Canada, even tried to intervene, but they were just not interested in having a quality program. It's shameful for Ghana, shameful for, the School of Medical Sciences at KNUST. And I hope really, they put the country first and they put the people of Ghana first.
Yeah, that's a shame, So in effect, that program didn't materialize.
Well, we started the program in 2008. 2018, it should have been a 2-year program. They recently graduated a few of them. So what they did was they brought some faculty who had really no knowledge of global mental health, from different faculties to supervise the students a second year in their thesis, just to let them, graduate. So they were just more interested in just graduating the students, but quality was not a consideration for them.
Wow. These are some of the things that can discourage someone in terms of giving back, because I know, people have different experiences of different challenges they faced. But I also know that, people don't give up.
Oh, no, I've never given up. I love my country. I won't give up on that. It's actually, I see it as a blessing in disguise. It's opened new opportunities for me since I decided to stop, leave that program for them. I've been offered 3 jobs as department head for 3 Canadian institutions. I was offered the job at the University of Alberta, University of Saskatchewan, and Dalhousie University. All wanted me to be department head at the same time, and I chose to come to Dalhousie, University for various reasons. And I believe I have the opportunity to establish a center for global mental health, which would have impact not just in Ghana, but across Africa and across the globe.
Good, great to hear. So hopefully this, email and text message pilot or program, it will go ahead, and I'm really keen to see what the outcome of that will be. Really,
no, for sure. Yeah. I mean, watch out for that for sure.
So what will your final message be for African diaspora who want to go back?
Well, we received a lot from Africa, and that's always not lost on my mind. I finished medical school without owning a dime. When you come to America, you come to Europe, people usually finish medical school with lots of debt. You come to Canada, the US, and even lately the UK, people finish university and they have loads of debts, to pay. But we all had free education in Ghana. I didn't own anything. So I think there's a moral imperative for all of us in diaspora, Africans in diaspora, to go back home and help. And even if we remain here, we should examine ways in which we can be of help to the people back home. We should really contribute to the growth, to the development of the continent. The continent has huge opportunities. I always say, if you go to Ghana, the Chinese are coming and investing, people from Germany, Europe, the UK. So how about us Ghanaians? The land belongs to us. So we cannot stay outside of the country and not be concerned about the opportunities that, the land presents. We cannot be unconcerned about the challenges that people are facing, and how we can be able to help address some of those challenges. So I'd want to kind of put out a rallying call for all Africans in diaspora, to look back at the continent and begin to examine, what they have benefited directly, indirectly, and what they can be able to give back to the continent.
Wow. Thank you so much. And I always say that the journey of giving back or relocating, it's different for everyone. And people haven't relocated, but they're doing great things back in Africa. And I think we need to, because often we hear that this person have moved or they've opened this, hospital or school or this, but it's always a process. It's a process. And it starts by connecting and doing things like what we've discussed about. So thank you so much, Dr. Japon, for sharing your experience with us. And there's one last question, which is optional. You don't have to answer if you don't. You see yourself settling back in Ghana or anywhere in Africa?
Well, I see myself certainly settling back home. It's something that I talk about all the time. For me, home is Ghana. Yeah. I'm very fortunate and very happy and comfortable, where I am. I'm very grateful for the opportunity, that Canada presents. But I have my family, my mom, my dad, my siblings. Everybody are in Ghana. So certainly, at a point in time, going to settle back would be a dream come true.
Same here, same here. Thank you so much. Thank you for your time. Thank you for your time. And we'll catch up and hopefully follow up on the plans in Ghana. So thank you so much. It's been a pleasure talking to you.
Thank you. Bye-bye.